We respectfully acknowledge that the Windsor Regional Hospital occupies the traditional, ancestral, and contemporary lands of the Niswi, Ishkwiden, Anishinaabeg, the Three Fires Confederacy, Ojibwe, Ottawa, and Potawatomi. We acknowledge the land and the surrounding waters for sustaining us, and we are committed to protecting and restoring these lands and waters from environmental degradation.
Good evening, everyone, and welcome to the January 5th board meeting, the first of 2023. I'm going to call the meeting to order, and I want to introduce a special guest. With us tonight, we have the Mayor of Windsor, Mr. Drew Dilkins.
Well, thanks. Do you want me to take it over, Mr. Chair?
Absolutely.
Okay. Thank you very much.
Yours.
Thank you very much, Mr. Chair, and members of administration and members of the board, and thanks for this opportunity. This may seem a little clumsy in terms of the presentation because I have nothing scripted, which is by design, but also you may have seen over the course of the last few months me giving some awards related to COVID to other people in the community, including Patty France, who's on this call here today. And I was trying to find the sweet spot of not trying to make it look like I was using these awards for the purposes of, getting attention before an election, but really trying not to let the whole COVID situation and the urgency that we all found ourselves in for 2.5 years sort of evaporate, and the awards not seeming contemporaneous to the actual event. And so I recognize that we are at a point where others have received this award, and I will just say that I'm right near the tail end, and this is really, I would say, among the best for last with these awards here from my perception and perspective here today. And all of you who serve as board members, all of you who live in this community understand the impact of what we've lived through collectively with respect to the pandemic and the impact that it's had, not just on the organization that you govern, but on the community as a whole. And I can tell you that it is amongst the most difficult periods of time that I can recall in the city's history, with the complexity of the issues and trying to serve all the various needs that were out there. And it was always imperfect. You could never hit the mark 100%. And you were often left just trying to do what was best with the information you had and get to the next day. And I remember from day one, the communication with Windsor Regional Hospital, and every day, multiple times from the start of the pandemic until almost this day. And so it was really important for me as mayor to recognize those who I felt really made a significant contribution. And I could tell you at the very beginning of the pandemic, probably like you, I thought this was going to go on for a couple of weeks or 3 or 4 weeks, and we'd be back to normal. And we know how that played out. And so as people started responding, some with time, some with money, we started keeping a little list. And very quickly after the first month, it was impossible to keep a list of everyone who was doing good things in the community because there was literally so many good things happening. And we put out a call to the community and we said, who are our COVID community champions? I have my list of people that I interacted with and that the public certainly knows the work that they've done, but who else is out there? We had over 500 submissions from members of the community with almost every story imaginable. And we gave out over 200 awards from that pool of folks, everyone from, when we had no PPE, people who were knitting masks and making masks, to everything in between, the kids selling lemonade to donate and buy food for healthcare workers who were isolating at a hotel, every story in between. And so tonight there were folks who, really the contribution was above and beyond. It was impactful. It made a difference. It was crucial. It was important. And I wanted to be here tonight to recognize the whole organization, but certainly a few key individuals as well. And first off, I would acknowledge Karen Riddell. and thank Karen Riddell for all that she did, the the work on the mass vaccination site and everything in between. Karen, I won't go through the litany of things that you had to deal with, but I want you to know that they, from my humble perch, they are truly appreciated and acknowledged. All of the things that I saw were absolutely incredible, and you are very deserving of this award. And on behalf of the city, it really gives me great pleasure to present this to you in a virtual environment and acknowledge the work that you've done. Also, Dr. Wasim Saad, and we heard Wasim on the radio so many times, providing confidence and guidance to people who were uncertain. We didn't know what we didn't know in this pandemic. And so the work and trying to pull together the medical teams and the staff and deal with the complexities internally that you had to deal with, again, absolutely remarkable. I'm not sure if Wasim's on the call, but I wanted to acknowledge him and thank him for his contribution as well. And then the person that I worked with the most, again, each and every day, multiple times, trying to solve some of these complex situations and make sure that we were working in harmony and as simpatico as we could, was David Mouche. And you really have a true champion there inside the organization who delivers. We saw David wearing scrubs and, up at 5 o'clock in the morning on the radio and on Zoom calls at 10 o'clock at night, dealing with issues that played out and everything in between, and trying to, again, manage the changing environment that was in front of him, trying to procure PPE from China when the entire world was descending on China, trying to find PPE to keep their operations going. And then dealing with the execution of the mass vaccination program, which is something everyone was waiting for in this community, really was executed flawlessly by David and the entire team. But it takes a leader to bring everyone together and make sure that everyone's rowing in the right direction. And David, I really want to acknowledge you and this contribution and the work that you've done. It really was remarkable. There you are. I have to scroll. I only have 5 or 6 of you at the top of my screen. So I want to acknowledge David for his amazing work. And all of us can work very, very hard and give it our all for a week, 2 weeks, 3 weeks, 4 weeks, 5 weeks, whatever it is. But this is a person who gave his all for over 2 years. And that takes a toll. Look what happened to me. And David, at least you kept your hair. That was good. And so, David, on behalf of the city, on behalf of City Council, I wanted to give you this COVID key to the city that acknowledges your leadership at certainly the most trying time in our city's history in my life. And thank you for all of the work that you did and acknowledge that formally in this environment. And there is one frame that is not in this picture. David, can I mention that one too?
Sure.
So there's one frame. This is nicely framed. It looks beautiful on the screen, but there is one award in here as well that I wanted to make sure and Dave and I talked about this, is making sure that we acknowledge the entire team at Windsor Regional Hospital. So there is a separate award for all of those healthcare heroes who came to work every day, didn't know what they were doing when they went home. Again, the uncertainty involved in what they had to do, and talk about intensity. People who had to work with no, it was relentless, no end in sight, who kept coming back day after day, dealing with the challenges that this pandemic threw in front of them. So I hope the frame, David, finds a real place of high profile at Windsor Regional Hospital. So all the men and women who work at Windsor Regional Hospital know that their city, that their mayor, that their city council, that their entire community values their contribution and is appreciative of the contribution that they made during a very difficult time. So members of the board and of the administration who are here, thank you for the time to join you today. I wish we could do this in person. It may be a little more personal had we done that, but I didn't want to leave the time. I didn't want time to get past us here. I wanted to make sure we get these out and acknowledge those who made a significant contribution. And you have many champions in your community who have done that. And I am very, very grateful, as you are as well. So thank you for the time today, Mr. Chair.
Thank you very much, Mr. Mayor. I just want to give Karen Riddell, Dr. Saad, and David a chance to respond, but we'll go to Karen first. Karen? any
Thanks, thanks, Mr. Chair, and thank you, Mayor Delkins and the City Council. On a personal note, it's definitely been an honor and a privilege to serve our community over the last couple of years, and definitely for the last, well, at least 22 years that I've been in this community, working in our healthcare community. But we couldn't have done it without everybody at the city, with all of our community partners, and definitely with all of our team members and the support of our board at the hospital. So thank you on behalf of the entire team and all of our providers that we worked with over the last 2 years and going into our third. So thank you.
Dr. Saad?
Thank you, Mr. Chair, and thank you, Drew and the City of Windsor. It's a tremendous honor. I'm humbled by it, and I don't know how to respond exactly when you're presented with an award like this, other than to say, as Karen mentioned, this is not an individual award as far as I see it. I'm certainly going to be accepting this on behalf of our entire professional staff, who did step up during the pandemic in times of uncertainty, picked up extra call, went in and saw those patients when we knew very little about the virus, and kept the inpatient units running and the vaccination clinics running, and it was certainly a team effort. So the recognition and award is obviously appreciated, and it's a true honor. But I will certainly be sharing this with the entire professional staff who also deserve it. So thank you very much.
I see David unmuted already. He's ready.
Yeah, thank you, Mr. Chair, and thank you, Mayor Dilkins. Just without repeating everything that Karen and Dr. Saad stated, even when I indicated to them something like this was coming, we all hesitated greatly because we wanted to make sure the only thing we're doing is accepting this award on behalf of the organization. And even though I know you're limited in how you can give these awards, you have to put a name on them. But we greatly appreciate that. But clearly, this was not a 1-person, 2-person, 3-person activity. It took thousands, tens of thousands, hundreds of thousands of individuals across Windsor, Essex to pull this off. And, you were wondering about timing. The unfortunate part is we're still in the pandemic. So the timing will never end. It doesn't want to go away. So you're well within the limits of giving these awards in the midst of the pandemic, because we're still in it. But again, just on behalf of Windsor Regional Hospital, I want to thank you for this recognition for all our team members. It's greatly appreciated, and I couldn't be prouder of the staff at Windsor Regional Hospital. They make me proud on a daily basis. So thank you.
I guess I'll follow that up. I can't be more proud, and I will speak for the whole board. I assume nobody's going to have any issues with this. Honestly, it is incredible what these 3 individuals have done, and the whole team has done over the past almost 3 years now. Every day I commend whoever I'm talking to with regards to the hospital. Every single individual there is put in the time and effort to make our community a little bit safer and a little bit healthier. So on behalf of the board, thank you and congratulations to everybody who earned this award, deserves this award. Thank you to the City of Windsor. Really, it means a lot to us, the board, to see the great people of Windsor Regional Hospital being recognized. So thank you.
Thanks very much, everyone. Thanks for all that you do on the board and the administrative staff as well. It's may not see everyone every day, but the whole team works very, very efficiently, and certainly the community acknowledges that, and I thank you very much. And I will leave your meeting so you can start. Have a good night, everyone. Take care.
Good night.
Thank you, Mr. Mayor.
I think that we should start every meeting with Mr. Mayor and giving a great shout outs to everybody on the staff. So I wonder if we can book them for the next meeting. But honestly, congratulations, everybody. I'm pretty sure he would have done this 6 weeks into the pandemic if he could have. You guys really did, all of you stepped up and made the community proud. So again, thank you. But I guess we do have to start the regularly scheduled board meeting. So do we have any declarations of conflict of interest? Seeing none. Wonderful. So pardon me, I am a little bit coffee today, so I may go on mute every once in a while, but I will do my best to keep it short and sweet. Just 3 things from me today. Number 1, the WRH 50/50 draw is still taking place. The draw is tomorrow. So tonight is your last chance to get 50/50 tickets. Number 2, I just want to say thank you to two of our partners. Really, number 1, it's the Windsor Cancer Center Foundation. Haven't actually mentioned them in a long time, but I wanted to say congratulations to them on raising $450,000 during the Grow On campaign. So congratulations to them. I'll talk about them more in a subsequent meeting. And number 3, I really do want to highlight this. It's an upcoming event by one of our greatest supporters in the community. It's Transition to Betterness. It's their 25th anniversary gala. It's coming up the end of January. They are still looking for table sponsors. They're still looking for people to buy tables. They are also looking for individual ticket buyers. It's pretty incredible what they've done over the last 25 years. Sorry, my phone shut and I've lost the number that they've actually donated to the community, but it really is an incredible number. It is $15 million in support over the last 25 years. It's a pretty incredible number, and I just want to thank all their staff, their volunteers over the years. So congratulations. If you haven't bought your tickets yet for their upcoming gala, you should buy them soon. But again, T2B, congrats on 25 years. With that, I will, I'm going to move it over to the report of the President and CEO, David Mouche. David.
Thank you, Mr. Chair, and I'm going to do a slide presentation, and I'm going to call upon both Dr. Saad and Karen Riddell to help me as we've done in the past. So just to give you a snapshot, again, what we've been focusing on the last few months is getting ready for influenza, RSV, dealing with COVID, plus still operating the hospital as we can. So what we've shown over the last few months, and interesting enough, it's doing as we thought it was going to do and as predicted, is this solid line here on the left shows what the influenza rates have been across Canada. And historically is the dotted line, shows the historical trend for the periods of 2014 through to 2020. And as stated, we looked to Australia, which had an early influenza season and a very rapidly growing influenza season. And we learned from them to expect the same. Sure enough, it happened. We had influenza happening weeks before it generally does. And then based upon the Australia history, is their influenza season, the peak was from the start to the peak was about 7 weeks, and then it started to descend. Sure enough, as we talked about last month, if we can get to that 7th week, chances are it's going to start to descend. This goes up to December 10th, and you'll see it's going down. And as predicted, we thought around sometime in December, we would peak and we'd start dropping with influenza. The issue here is the impact of the actual holiday season happening as we start descending. Is it going to level more off and last a little longer before it totally drops? Meaning it's going to, right at this point, is it going to start flattening out like the previous years? we're going to have to see. So this is a short, closer up. So we'll see if that line starts to flatten out now, or if it continues to drop. Hopefully it continues to drop, but because of, again, the holiday season happening and people gathering, that might not be might not happen. So the other thing is just with respect to our ED volumes, what are we seeing with respiratory cases? They dropped a little bit in the month of December as compared to November, which is consistent with the previous slide. Again, these are all respiratory issues. You'll see our overall ED volume stayed constant at around 7,300. Then this is a little more difficult to see, but you'll see our influenza numbers. As the rest of Canada, we had our peak in November, and then it dropped off in the month of December. So it went from 116 cases that were in the hospital, inpatient cases, down to 79. The same RSV also stayed pretty much constant. The issue is COVID started to creep up a bit in December as predicted. So where are we at with respect to occupancy? These are yesterday's exact numbers, but we're at 92%. That's starting to creep up. It's getting closer to 100% as we talk. We still have the admit no beds, even though there's quote percentage capacity. We can't locate a particular patient in a particular area because of the issues they're dealing with. So as a result, they're waiting in the emergency department for a bed. Our pediatric volumes have gone up and down. The month of December up until Christmas was pretty good. We had capacity, and then after Christmas, it started to escalate again and get closer to full capacity. But we see the numbers in peds fluctuating rather dramatically. And ICU is where it's at. The ICU, again, we've had pretty good capacity throughout the last month or so in the ICU, give or take, and that's consistent for both campuses. From an alternative level of care position, as stated back in September, before Bill 7 came in, we had 33 ALC patients with a combined 913 days. They were averaging 27 per person. That number, consistent with last month, has gone down. Last month around 15, 18, it's around 19. So it's, a little more than half, but the days are a third of what they were before. So again, we've tried to stress, Bill 7 has allowed far greater discussion with family members on opportunities, be it at home or be in the community. We came close to issuing a letter. We didn't technically have to. So as a result, officially, we have not issued the $400 letter yet to anybody. And I don't know how many across the province, but I don't think there's many, because if there was, we would have heard a lot about them through the media or otherwise, and we didn't. So that's not to say, again, that there will not be. But again, the concern regarding Bill 7 right out of the gate probably hasn't played out at that level. It's actually helped dramatically, as we had stated it would. Again, will there be $400 letters? Of course, there might be $400 letters, but they're not the way it was being played, as if they're going to happen every day and there's going to be multiple letters like that. That's not the case. And as a result, it has helped out and has helped flow for ourselves, because again, if we didn't have these 15, 20 beds on a daily basis, would make a big difference. One of the issues we're still struggling with is COVID. And Dr. Saad will be talking about COVID and some of the things that we've heard about regarding particular COVID numbers. My computer's acting up a bit here. And you'll see from the presentation that our wastewater data has unfortunately started to increase. So the COVID levels in wastewater are now at a level as of January 1st of 2023. We haven't seen this height since the months of April, May of this year. It shows a little dip there, but is that a temporary dip and it's just going to bounce straight back up? We'll have to see. They have not done the genome breakdown to see what subvariants or variants this is. That's still happening. So Dr. Saad will be talking about the subvariant that has taken over the media lately with respect to what's happening in China and what's happening over here in Ontario and across Canada and the United States. So unfortunately, as predicted, fortunately, influenza and RSV seems to have peaked and dropped a bit. COVID, unfortunately, was predicted to go up in January, and it is. So we'll have to see where these, if this continues up on the scale that it is now. But unfortunately, we are not out of this pandemic. And as we know, the more this virus replicates, it mutates and possibly different variants. So I'm going to pass it over to Dr. Saad with respect to what's happening clinically with respect to COVID. Dr. Saad.
Thank you, David. So as David mentioned, as I'm sure we're all aware, the COVID pandemic is nowhere near ending. There are continuing to be more and more waves of infection. And as more people get infected, you run into scenarios where you can get not just mutations, single point mutations that lead to variants, but every once in a while, you'll get what's called a recombinant variant, where a person is infected with two different variants, and then they share genetic material, and then all of a sudden you have what's called a recombinant variant. This particular one you're going to be hearing about over the next several days and weeks, likely. It's a subvariant of Omicron. And as we know, Omicron was the most infectious variant of COVID, and now this is the most infectious subvariant of Omicron. It's XBB.1.5, and some people have dubbed it the Kraken variant. Do not ask me why they called it Kraken or where they came up with the name. I don't think there's any rhyme or reason. It sounds very menacing, but what we do know now is that A, it is very infectious and highly transmissible. B, it is a recombinant variant, which means that clearly there's still a lot of spread of Omicron worldwide. As a result of it being so infectious, the numbers are skyrocketing. So at the beginning of December in the United States, this represented less than 0.1% of all infections. The week before Christmas, it was up to 20%. At the end of December, it was up to 45%. And in the Northeast, and including Michigan, it was accounting for up to 75% of all infections. And we do know in Windsor, being a border city, that we are going to be one of the first areas in Canada to see a variant like this enter our community. And I don't think there's any question that it is already in our community. Now, it's not all bad news. The good news is there was a small study in the New England Journal of Medicine that shows that the bivalent vaccines do have good effect against this subvariant. And we also know that some of our therapeutic measures are also effective against the subvariants of Omicron. So with simple vaccination and mask use, there is still, we still have great mitigation strategies for the spread of the virus, and we still have therapeutics that can work for it. What we do not know yet about this subvariant, about the Kraken variant, is how deadly it is. We're not sure whether it's leading to increased hospitalizations, but the World Health Organization is doing studies and tracking it very closely. But this is a variant that you will be hearing a lot about in the next couple of weeks, because it is likely to become globally dominant in the near future.
Thank you, Dr. Saad. I will now pass it over to Karen Riddell.
All right, good evening, everybody. I'm just going to take a couple of moments just to refresh everybody on our clinic that we do have available. Back in November, we did update the clinic patients that we were able to see based on the new provincial guidance. So our COVID-19 assessment center was expanded to allow us to service all respiratory illnesses, including COVID-19, influenza, and RSV. And that's for both adult and pediatric patients. We do recommend you seek care at your primary care provider first, and certainly any children or adults with severe symptoms such as difficulty breathing, excessive vomiting, change in level of consciousness, any lacerations or broken bones should still be going to call 911 or going to the emergency department. And for adults, in addition to those symptoms, any chest pain or confusions should also go to call 911 or go to Emerge. So our service hours at the clinic are 9 a.m. to 3 p.m., 7 days per week, including holidays. So we were open all across the holiday season. We have same-day appointments available. We offer COVID-19 testing for eligible patients, clinical assessment for respiratory illness. We do provide clinical treatment for COVID-19, including remdesivir and Paxlovid. We have physicians and nurses on site. Reminder that appointments are required. And I think on the next slide, I'll give you the information on how to book an appointment there. There we go. So you can book an appointment by going to wrh.on.ca/online booking. And if you don't have access to a computer, you can also call 519-973-4443. And those phones are answered Monday to Friday between 8 a.m. and 4 p.m. And again, same day appointments are available. So we've got lots of capacity if you need to be seen. Just an update on the volumes that we're seeing in the clinic. So we see between 40 to 70 patients per day, and that really varies by the day of the week. We saw a slight uptick after the holidays. The majority that are attending are requiring testing for COVID-19 based on the eligibility criteria. And we're treating anywhere between 1 and 5 patients per day that are eligible for remdesivir or Paxlovid. We get about 20 patients per day that require a clinical assessment under the updated criteria for respiratory illness. And this is a little bit different. So prior to Christmas, when we reported out, approximately 14 of those 20 were children, and now we're down to about 5 to 6 per day on average, and the balance being adults. So population has changed a little bit, and we're happy to see a decrease in the incidence with kids. So hopefully that stays that way. And that's it.
Great.
Well, thank you,
Thank
Mr.
you.
Chair. That's our report.
Wonderful. Does anybody have any questions for David, Dr. Saad, or Karen? Danielle?
Yeah, hi guys. I'm just wondering if we know how long that respiratory clinic will be around for.
At this time, we don't have an end date for the clinic. I imagine that the province will continue to support these clinics. They're open across the province until there's no longer a need for them. So at this time, we don't have a close date.
I got a minimum until March 31st of 2023. They're open till. And again, Dr. Soulier, I would imagine I had a call today on them, and just saying in general, they've been very successful. Even though it's great, we're not at 100%, but I said, if we were to close these clinics and those volumes were to have to be a primary care or an emergency department to be dealt with, that would, having 60 extra patients in the emergency department would be very difficult. So it has served its purpose. So there'll probably be a push to have them in some fashion on an ongoing possibly. So we'll see.
Yeah, I was there earlier this week. It was definitely very busy. I guess I just wonder for selfish reasons, for scheduling purposes.
Oh yeah. So at a minimum,
we'll find out if it's extended past March. Yeah.
Yeah, we'll know hopefully in the next month what we'll pressure to say, should we put schedules together for April? So I would imagine they'll say something short.
All right.
All right, Anthony.
Yeah, all good. Sorry about that, Dr. Soulier. I did not introduce you properly there.
He might need to go to the doctor.
I might be in the clinic tomorrow.
I will always take care of you, Anthony. Don't worry.
Oh, thank you. Any other questions or comments? No, thank you very much for your report. So, the mayor got me all confused, and I completely forgot to get the previous minutes approved. So I do apologize for that. Can I get a motion to approve the previous minutes? Paul's seconded by Ian. Questions or comments with regards to those minutes? Seeing none, all in favor? Thanks. Sorry about that again. We have the report, the Schulich report there from Dr. Jacobs. That's there for your information. Unfortunately, he could not be here tonight. So we will move directly into the financial presentation with Mr. McLeod.
Thank you, Mr. Chair, and Matt. Oh, there it comes. Good evening, all. Matt, if you could move to the first slide, please. Good news on the funding front. Was just announced and has not been included in the November statements. We've received one-time funding for pandemic prevention and containment for the period from July 2022 to March 2023, and that amount of money is a little over $2 million, 2.2 million to be exact. Next slide, please. The budget surplus for the hospital operations is $4.8 million, which is 90,000 worse than budget. The surplus from operations for the year to date is 90,000 worse than budget to the end of November. The net surplus after building amortization is $3.9 million, which is 372,000 better than the budget. The next slide, please. This slide shows the breakdown of 16.6 million in COVID expenses. Of that, 11.9 million has been funded, leaving an unfunded amount of around $4.5 million. This relates to the wage differential for nursing externs. Expenses are no longer funded via incremental expense reimbursement after June 22nd, which will change and will be reflected in the new budget. For sick and isolation costs, additional staffing and the period-operative program, incremental PPE, and additional shuttle costs and storage of equipment. We expect that the 342,000 that you see in the middle column for medical staff will be funded. Revenue shortfalls in three categories below on the right-hand side of the slide are not funded, and they're volume-based for quality-based procedures, neuro, cardiac, and wait time. And when compared to the budgeted volumes, there is a $7.5 million shortfall. We have a shortfall of 2.2 million revenue loss in patient services and a 500,000 revenue loss in other recoveries. Next slide, please, Matt. Salaries and wages are showing a deficit of $3.9 million, almost $4 million. And that includes temporary retention incentive for nurses, payment of $3.2 million, which was fully funded. It also includes $6.5 million in funded expenses for nursing externs, PPE, and COVID incremental cost. Medical staff fees are showing a deficit of $6.2 million. There's 3.7 was funded through COVID temporary physician funding, and $3 million is offsetting favorable patient services revenue. Medical services and supplies are showing a $1.8 million deficit. 65% of this relates to incremental PPE. And drugs are showing a deficit of 2.4 million, which is offset by a favorable revenue in retail pharmacies. The last slide, please. Other supplies are showing a $2.1 million deficit, which consists of $717,000 for building and grounds maintenance and service contracts, $328,000 for patient transportation costs, patient transports to hotel due, nursing and retirement homes in order to free up beds, $344,000 for physician recruitment, and $192,000 for minor equipment purchases. Other supply surpluses in other categories do offset some of these deficits. Mr. Chair, that is my report, and I would make a motion that the financial presentation for the results for the period ending November 30th, 2022 be accepted.
Wonderful. Seconded by Dr. Freeman. Thank you. Questions or comments? Seeing none, all in favor? Thank you, everybody.
And my last motion, Mr. Chairman, is that the report for the Finance Audit and Resources Committee for the for the period or for the date December 19th, 2022 be accepted.
All right, seconded by Genevieve Eshok. Thank you, Genevieve. Questions or comments? Seeing none, all in favor? Wonderful, thank you. We have our correspondence and printed material there as an FYI. That's in tab E. The date of our next regularly scheduled board meeting is February the 2nd, 2023. And again, on behalf of the board, I want to say a big congratulations to the team and for the awards that were presented here tonight. You guys really do us proud. Continue to do a great job, and we really do appreciate it. And secondly, Happy New Year, everyone. Looking forward to a hopefully a quieter 2023 for everybody involved. Can I get a motion to adjourn? Patty France, seconded by Laura Copat. Thank you. With that, why don't we say 5 minutes? We'll jump back on in 5 minutes for the in-camera session. I assume that Dave and the team will be in the scrum for a little bit.
All right, see you in a bit.
Okay, thanks, everybody.